Okay. The lymphatic system. You know, the lymphatic system doesn't get a lot of press. You know, it's not something we can so easily wrap our arms around. It's not like studying the heart, you know. You got a heart model there, and you got all these pictures, and everybody knows about the heart, you know, and the digestives and the lungs, you know. So, you know, the lymphatic system for some people is, you know, more nebulous. But I can assure you that it is absolutely essential. Absolutely essential. If it weren't for the lymphatic system, we wouldn't be here today, more than likely. Now, this is not the entire lymphatic system. But what it gives you an idea about is what it's like. So the lymphatic system is made up of lots of lymphatic vessels, lots of lymphatic tissue, and that fluid that's in the vessels, you know, it's not blood, it's not plasma, it's lymph. And we have some organs that are classified under the lymphatic system. So we have many, many lymph nodes. We have a spleen. We have a thymus, or at least we did when we were young. We've got tonsils. Okay, so all of those are part of the lymphatic system.
Part of it.
Whenever we talk about a new organ system, we need to know the functions of that system. All right, so the lymphatic system has an important contribution to circulating blood volume. And you may have absolutely no clue as to how that is so, but I hope that I'll be able to explain it to you. It's intimately involved in our immune response because of its contained cells. Most of our immunity is in which type of white blood cell? Lymphocytes. The name fits, doesn't it? Mm-hmm. Lymphocytes, lymphatic system. So, very important. And some other white cells are important in there too, like monocytes and macrophages. But, all right, so these lymph nodes that we spoke of, and the spleen, and the liver to an extent, are filtering mechanisms. So this lymph picks up various and sundry things and carries them in dissolved in lymph. You know, some plasma proteins that leak out of blood vessels, they pick them up. Hormones, they pick them up. Foreign antigens, they pick them up, and they can feed them through these filtering devices, because this lymph on the way back to as it goes back toward the heart area, is being filtered through many, many lymph nodes. So we'll be looking at those. All right, now the spleen, one of the lymphatic organs, and also the liver to an extent, although the liver is not classified as a lymphatic organ. But the spleen is an important filter of blood, isn't it? Because the spleen is the primary organ that's taking our old and damaged red blood cells and platelets out of circulation. Is that not right? Mm-hmm. All right, so that. Also, from our food digestion, large fat molecules that are too big to be picked up in blood capillaries and passed on to the liver are picked up in lymphatic capillaries. We'll be looking at those when we get to the digestive system. So again, the lymphatic system has a role in digestion, you know, the absorption of our, not digestion, but absorption of our food nutrients. Now, this is just a very basic diagram that shows you the relationship between the blood circulatory system and the lymphatic system. So the blood circulatory system here is shown in the red and the blue. Red is the arterial side, blue is the venous side. This is the heart, right here, the pump. So blood that's in arteries passes through progressively smaller arteries until it comes to capillaries. and that arterial blood flows into capillaries, and then eventually flows out of those capillaries into venous blood and back to the heart. Now, this that's shown in green here represents the lymphatic system. So it's a different system altogether, but it's related to the blood system, as we shall see. Now, when we talk about the lymphatic system, we're going to be talking about it in this order here. The vessels, the fluid in them, lymph, cells, lymphoid tissue, and lymphoid organs. Lymphoid organs contain lymphoid tissue. The difference between lymphoid tissue and lymphoid organs is that those organs have a defined capsule. Lymphoid tissue is present in many, many places in the body, unencapsulated, small little nests of it, scattered in many places in the body. All right, so let's take a look at the lymphatic vessels. Now here's another view of that earlier diagram that I just showed you. Here is the heart, here's the arterial circulation, capillary intervening, and then the venous side of the circulation. Now we're getting a little bit more of an idea of how the lymphatic system relates to the blood system. You see this intertwining here of blood capillaries and lymphatic capillaries? That's very important, very important. Here is a magnified view of this right here. So the red and the blue represents a blood capillary, and these green vessels represent lymphatic capillaries. So what happens, you know, where does this fluid come from that's in the vessels? Most of it came from blood. So as blood is pumped by the heart through the arterial side of the circulation, it's entering the capillaries down here under some pressure. And that pressure pushes some of the plasma out of the capillary into this interstitial tissue. Now, we're going to be talking about this later on, but I'm just introducing it now. As that blood flows through the capillaries from arterial to venous side, the pressure is dropping. And so those plasma proteins inside blood vessels are exerting a different kind of pressure. The pressure coming through the artery here was hydrostatic pressure. It's a pushing pressure. And the pressure is so great that it pushes some of the plasma and even small proteins out into the interstitial spaces here. As that blood pressure drops, this constant pressure inside the vessel, the osmotic or oncotic pressure, sucks, if you will, most of that plasma back in to the venous side of the circulation, but it doesn't get all of it. The lymphatic vessels pick up the fluid that doesn't get back into the bloodstream, and they pick up any of the smaller plasma proteins that were pushed out with that plasma, and they carry them back to the bloodstream too. Because if you'll notice here, if we follow this on up, we will see that our lymph is eventually going to join the venous circulation, isn't it? So we're not losing any of our circulating blood volume, are we? So let's go back to our functions. And you see here, one of the functions is contribution to circulating blood volume. Now, what happens if you get a serious drop in circulating blood volume? What happens to your blood pressure? It goes down, doesn't it? Somebody who comes into the emergency room in acute hemorrhagic shock, they've lost blood out of the site, right? And they often come in with a very low pressure, don't they? One of the big reasons for that is they don't have enough circulating blood volume to keep the pressure up. So you see, if we didn't have the lymphatic system, we couldn't keep our circulating blood volume up, and we'd be swelling out in the peripheral parts of our body, wouldn't we? And that happens sometimes when you have obstruction, as we'll talk about. All right, and so then let's look at these vessels, starting with the very smallest to the biggest. The smallest ones are capillaries, and they're found in many, in fact, most parts of the body. But there are a few places where they are not found in the body, which you will need to know. And where will those places be? Central nervous system, bone, bone marrow, teeth, cornea, and I left one off, epithelium. You won't find any lymphatic capillaries in any of those places, but you'll find them everywhere else. Now, compared to blood capillaries, they are larger and they're thinner walled. They have one-way valves and they're blind-ended. Now this blood capillary here is not blind-ended, is it? It's got arterial blood flowing in one end and venous blood flowing out the other. But here is a lymphatic capillary right here. Here's the beginning of one. It's blind-ended. Also, these gaps between lining cells are larger than the intercellular clefts in blood capillaries. That lets larger things in, doesn't it? Like hormones, proteins, various foreign antigens that are proteins and so forth, they can get in through here. These tend to be one-way valves. Once something's in, it can't get back out because of the way the overhang is on the edges of these vessels. All right, and from capillaries we go to collecting vessels, which are associated with blood vessels. They're similar to veins because actually they embryologically develop from veins. They're much more delicate, they're more numerous, they're not easily seen. This thing about not easily seen, you know, when you're present for a surgical operation, or even if you're dissecting a cadaver, it's fairly obvious what an artery is and what a vein is. But it's not so easy to see the lymphatic vessels because they tend to be smaller, their walls are thinner, and lymph is generally clear, and so they're there. It's just, and you can find them by searching for them, but they're not just, they don't just pop up so that you can see them so easily, but they're definitely there. Now, where are these collecting vessels going to be found? All kinds of places. Subcutaneous tissue. What is subcutaneous tissue?
Under the skin.
It's tissue that's deep to skin and superficial to muscle, right? So a lot of that is fatty tissue, isn't it? All right. Areolar tissues are mucous membranes. The mucous membranes of our respiratory tract, our digestive tract, urinary tract, reproductive tract, those have mucous membranes. That's the epithelium. Well, deep to that epithelium is areolar connective tissue. And you find these lymphatic vessels all through that. Okay? In the lining of our thoracic and abdominal cavities, in the pleural lining and in the peritoneal lining, you find them. They also run with large arteries, like aorta and its major branches. And the pulsation of those arteries is one of the things that helps them move back toward the heart. Then we have trunks. These collecting vessels in various regions form trunks. So you'll have an intestinal trunk, you'll have a bronchomediastinal trunk, you'll have a jugular trunk, a subclavian trunk. These are just larger lymphatic vessels that are leading into the two largest lymphatic vessels. which are called ducts. These are the two, the right lymphatic duct and the thoracic duct. So if you look back here, here's our capillaries, here's our collecting vessels, here's our various trunks, and here are our ducts, the closer we get back toward the heart. Now, for example, this is one of those ducts, the thoracic duct. As you can see here, these are ribs. So this thoracic duct is starting just below the diaphragm. It's coming up in the mediastinum. The mediastinum is that space, as you know, between the two lung cavities. It lies posteriorly on the vertebral column, behind the esophagus. And it's coming on up like this. It's green, colored green here, although lymph is not green. And you can see it curving around the brachiocephalic vein and joining the venous circulation between the internal jugular vein here and the subclavian vein here. The right lymphatic duct is this one right here, and you can see that it's emptying its lymph into the venous circulation at exactly the same anatomic spot as over here, just on the other side. So all of the lymph that collects from all of the body converges ultimately on these two ducts right here. Now you might wonder how big this thoracic duct is. You think it's as big as my thumb? No. It's as big as my index finger? No. It's probably about the size of a small drinking straw. Depending on the person's stature, it could be the size of a large drinking straw, but something like that. Now, the question is, for you, is what parts of the body do these two ducts drain lymph from? This diagram tells you right here. What you see in beige up here is what the areas that the thoracic duct drains. So you can see that the thoracic duct drains all lymph from below the diaphragm, from the left hemithorax, left upper limb, and the left side of the head and neck. All right, what does that leave that the right lymphatic duct drains? Everything else. The right hemithorax and the right side of the head and neck. All right, so I'll just introduce now this. This is the fluid that's contained in these vessels. What is it most like? Plasma. But it's not plasma. It's not exactly like plasma. And the main difference is that it doesn't have the protein content that plasma does. Now, because remember, blood has some very large plasma proteins. They cannot get out between the capillaries. All right? They can't get out those intercellular clefts between the lining of the capillaries. So generally, lymph is going to have not certainly the same protein content as plasma. It's normally clear. Lymph is clear. Now, after a person has eaten a meal with a fairly high lipid content, and if a surgeon happens to be dissecting up into this area where the thoracic duct empties in the venous system, and if the surgeon unintentionally cuts the thoracic duct, not recommended, you will see that the lymph will not be necessarily clear, but might look like very dilute milk because of its content. You know what rice milk looks like? Mm-hmm. You know, if you dilute rice milk way down, it might be what lymph looks like after a person's eaten a fatty meal. Now notice on the way up, this lymph is passing through multiple filters, multiple lymph nodes. Because you've got, on the way up, there's some vessels that lead into lymph nodes and vessels that lead out of them. We'll look at those later on. All right. We are out of time. According to my watch, you got a few minutes, but I'll give you my watch. So we'll pick up here.